Hello, I'm Dr. Ronald Seel, and I'm the Director of Brain Injury Research here at the Shepherd Center. Our mission in doing research is to conduct practical studies that improve our ability to assess, treat, and optimize people's recovery after they've had a brain injury. We also do research to help families out in their transition after their loved one has had a brain injury. We really focus on conducting practical studies. We often include family members and patients and clinicians in both the selection of research studies and in planning out the specifics of research studies, because we really want our research to have a practical application and benefit people rather than just sitting in a library on a bookshelf. I think research is really important. Research allows clinicians at Shepherd Center to know how to best diagnose people, how to best treat people, and how to best know what might be in store for the person and family when they leave, so that people can do the best planning that they can once they return to their home and community. One of the great things about our Shepherd clinicians is when they feel a little bit stuck with a patient, they come to me and ask for research so that they can identify different ways or better ways of doing what they're doing. And I think that sort of highlights why we try to be so practical in our approach to conducting research here. The only way we can do that is to get your help as patients, as family members in participating in research, so we can identify what's important to you so that clinicians can better serve your family member and your family. At the Shepherd Center, we conduct two types of brain injury research studies. The first type of study is an assessment study. And we typically do assessment research when we want to better understand either what a person's problem looks like or the factors that might impact a person developing a certain problem. Assessment studies do not involve any treatments, so typically we would either sit down with a patient or family member or give a patient or a family member a survey questionnaire to complete. And this would provide us with a wealth of information that we could then use to better understand a person's condition and ultimately how we might be able to design interventions to help people out. The second type of study we do at Shepherd Center are treatment studies. When we do a treatment study, we usually examine either a medication or a rehabilitation therapy that is normally delivered during a person's treatment. Typically, these are treatments where there is not a lot of research as to whether the treatments are effective or not, and our goal is to do our best to identify which treatments are most effective so that we can get patients better more quickly. Examples of treatment studies that we currently have going on at Shepherd Center include a randomized clinical trial looking at two different medications to treat attention difficulties after a person has had their brain injury, as well as looking at the medication Ambien, which has been shown to help a small number of persons who have disordered consciousness wake up. Treatment studies may have more risk than completing a questionnaire. So we typically spend a lot of time with patients and their families to discuss the goals of a treatment study, both what we're trying to accomplish as well as what risks might be involved in being involved in the study. So we'll let you know if we're comparing a treatment to a placebo, which is sort of not a treatment, or if we're comparing two treatments to each other, or if we're trying to determine what dose of treatment is most effective or what duration of treatment is most effective. We also will spend some time talking about what side effects may potentially be involved. At Shepherd Center, I only have one criterion as to whether I approve a study to go or not go, and that is, would I consent my family member to be in the study? If I don't have a clear yes in my mind that I would put my own family member in the study, then we don't do it. We either try to fix the study, we talk to clinicians or family members and ask them how we might better do the study so that we feel good about asking people to be in it. Because we conduct treatment studies on unproven therapies, we can't guarantee that any treatment that you might receive in research is going to work. What we can guarantee, though, is that the research study that we're doing is a practical issue, it has real-world implications, and it has the potential to help other patients, other family members, and other clinicians both here at Shepherd Center and around the country. For the family members who are watching, I know you've been through an incredibly difficult time, both early on after the injury as well as here at Shepherd Center. And our goal in approaching you about research is to be very respectful of your circumstance and time. We're not looking to make a hard sell on involving you in research. The choice is completely yours. When appropriate, we try to design brochures for family members and patients that summarize our research findings in a way that is easy to understand and practical to use in your home and community circumstances. I'd like to thank you in advance for considering any research opportunity that we might present to you. We're very appreciative of your time, and we wish you and your loved one the best in your stay here at Shepherd and in your long-term recovery.